Good afternoon, ladies and gentlemen. My name is Taylor Colbert, and today I'll be presenting a speech on Marfan syndrome, and I do have a PowerPoint to show, so I will share my screen so y'all are able to see it. Oh, let's go back one, or maybe not. There we go. So, Marfan syndrome is a type of heart disease. First, heart disease refers to the several types of heart conditions, which is quoted by the CDC. The most common would be coronary artery disease, and heart disease is a leading cause of death in the United States, causing about 1 in 4 deaths. But now that I've gotten some statistics and some deaths, cause of deaths out of the way and stop scaring you all, let's dive a little bit deeper on what Marfan syndrome is. So Marfan syndrome is a genetic condition that affects connective tissue, which provides support for the body and organs. Marfan syndrome is very rare, happening about in 1 in 5,000 people. Marfan syndrome is caused by a mutation called by the FBN1 gene. The mutation limits the body's ability to make proteins needed to build connective tissue. 1 in 4 people with Marfan syndrome develops the connective for unknown reasons. So for pathophysiology, there are many parts of the bodies that are affected with this disease. For example, eyesight, lungs, cardiovascular system, and the skeletal system. This picture here just depicts the thoracic artery aneurysm and how this is very enlarged and how the fatty deposits lining the aneurysm and the aorta, weakening the wall of the aorta. So this is one of the common signs that you'll see with patients or who have Marfan syndrome. Here, this other picture is the body affected by Marfan syndrome. So eyesight, which people will be nearsighted, eye lens dislocation, retinal detachment, lungs, spontaneous lung collapse, aortic widening and dilation, aortic aneurysms, skeletal system, well, the curvature of your spine, and so on and so on. There's so many body parts that are being affected with this disease, unfortunately. Some of the symptoms are limited, but that include but do not limit. Sorry for the verbiage there. Disproportionate long legs, arms, toes, and fingers, extremely tall and slender builds, long, narrow faces, high arched necks and crowded teeth, indented or protruding sternum, which is the breastbone, dislocated lenses of the eyes, as I've said earlier in the previous slide, high pressure in the eye, which is glaucoma, cystic changes in the lungs, flexible joints, flat feet, curved spine, as I said in the previous slide. And there's also some abnormal heart sounds. This is not all the list of the hallmark symptoms of Marfan's disease. This is just some of the notable ones that you'll be able to see in a person passing by. So the disease progress. The child of a patient with Marfan syndrome has a 50% chance to have this gene. This is an inherited gene, so it's very encouraged that parents, children, making sure that you know your heritage, so some of the conditions that you might have passing on to your kids. So the natural history, 84 people were diagnosed between January 1959 and June 1987, and that was the earliest dated back information that I could find on how it became discovered. It is also named after a person, as most things are in this country. So here's also the picture of, as I said earlier, with the inheritance of the Marfan syndrome. So the father with the Marfan syndrome, and then a mother without the Marfan syndrome. And as you can see, 2 children, out of 4 kids, it's obviously 50-50 chance. So 2 children don't have the Marfan syndrome, but 2 children do have the Marfan syndrome. Continue on. Unfortunately, Marfan syndrome, there is no cure for it, but there do have tips that doctors and nurses and practitioners always try to make sure that Marfan syndrome patients partake in. So making sure that they find enjoyable activities that are safe for their heart. So some activities but are not limited to are non-competitive swimming, walking, golf, and bowling. It may be good alternatives for the strenuous sports that people might love. making sure they emphasize or making sure they focus on what they can do and not what just they can't. So this also could include skating, circling, brisk walking, bowling, and golf, as I said a little bit earlier. And so just making sure that they talk with their doctor which sport options may be a good fit. Another good tip, because with Marfan syndrome, as I stated earlier, that one of the symptoms and key signs would be vision problems. So maybe making sure you get contact lenses or glasses to correct the nearsightedness in their eyes, making sure that they maximize bone health. So that means taking vitamin B, calcium, and other supplements that support bone health, and use a brace and other strategies to support their spine and promote good health. And also, please, we make sure that doctors make sure that patients do not smoke. So these are some more current treatments because Marfan syndrome is not rare. So blood pressure medicines, which are ARBs and ACEs, and these are beta blockers. And this picture just depicts how the beta blockers work. So the patient will take the beta blockers into the bloodstream through the gastrointestinal tract. The receptors will be blocked. So the beta blockers prevent adrenaline from attaching to the receptors on the heart cells. And then the heart rate is now normal. So that means heart rate stays normal. Fight or flight reactions do not occur. There's also for the patients that have curvature spine, there are back braces, and there also are some numerous surgeries that people can do for the scoliosis that they may have with Marfan syndrome. This picture here on the right indicates a woman who's in a full back brace that's extended to her thighs to kind of help the bend and the curvature. And on the left, a young boy who got surgery to help the C-shaped spine. Another experiment that in 2017 was created was a heart failure Marfan mice. And that's where in this picture, you can see that there's two mice on a wheel, a normal mice and a Marfan mouse. And on the Marfan mouse, it's the big red dot indicates the heart failure, the larger aorta, the larger heart diseases that or heart problems that the Marfan patients may have. And on the right is a normal mouse. And in 2017, some people from Johns Hopkins Hospital tested on mice to see if they were able to reverse or help with the heart failure. And that will be all for today. I just want to say thank you for attending the speech.